Welcome back, everyone. 7:16, and this morning, doctors are working on new weapons in the fight against cancer. So Dr. Lorenzo Cohen from MD Anderson is here to talk about a little seminar on cancer treatment and prevention that's going on here in Austin. Thanks so much for joining us this morning.
Great to be here.
So let's talk a little bit about the methods and maybe what you're going to be talking about at today's seminar.
Well, so one aspect of today's Lunch and Learn session at the Hilton is going to highlight our Moonshots program, which is a huge investment, both financially as well as intellectually, in really trying to get at the root of what's going on with cancer development, and understand and manipulate some of the genetic basis and develop what's called personalized therapies to really move the dial on improving outcomes.
And some of those therapies, it's pretty interesting when we talk about things like yoga, acupuncture. Walk me through kind of some of those things that people, these aren't treatment forms, but like therapies, like you mentioned.
Well, so this whole field of integrative oncology, as we call it, is extremely important for helping with symptom control. But we also know that we really need to focus on lifestyle factors. 1 in 2 men and 1 in 3 women will be diagnosed with cancer in their lifetime. And we know that at least half, if not more, of those cancers could be prevented in the first place. Smoking accounts for over 30% of cancers. Diet, exercise, and being overweight, we know accounts for another 30% or so. 15% is associated with risky sexual behaviors, contracting the human papilloma virus, HPV, and there's a vaccine against this virus. So our lifestyle factors are really the primary influence if we're going to get cancer or not.
Yeah.
2/3 of our population is obese, and obesity is directly linked with many different cancers, and importantly, worse outcomes after a diagnosis of cancer. So if you look at something like yoga is a real lifestyle kind of practice.
Yeah.
It can be approached just as pure exercise, but if you incorporate the stress management component, we know stress speeds the aging process, and advanced age is a risk factor for cancer.
Yeah.
That if you manage your stress, if you exercise well, if you sleep well, and you have a healthy diet, which is primarily a plant-based diet, you will decrease the probability you'll get cancer. And if you already have cancer, we know it's going to improve your outcomes.
Things we've heard a lot, diet, exercise, sleep. If you practice it, it can really make a difference. Doctor, thank you so much for being here this morning. And there are some spots still left for today's seminar. Doors open at 11 a.m. for the Making Cancer History seminar. It's at the Hilton on 4th Street. Everyone is invited. It's free. You can find registration information we put in our website at kxan.com.